Welcome to the Pathways to Wellbeing documentation course, Pathways to Wellbeing Child and Family Team Meeting Referral Form. This course is one in a series of learning opportunities designed to help you familiarize yourself with pathways to well-being and continuum of care reform concepts, practice, and documentation. Pathways to Wellbeing supports youth by bringing together the child or youth and their family, behavioral health services, child welfare services, and other critical partners to support the safety, permanency, and well-being of youth involved with the child welfare system. As a behavioral health service provider in the County of San Diego, your responsibilities under Pathways to Wellbeing include creating and maintaining complete and accurate documentation of service activities. This course will describe the Child and Family Team Meeting Referral Form and how and when to access and complete the form to request a child and family team meeting. This short course is designed to introduce you to the Child and Family Team or CFT Meeting Referral Form. In this course, you'll learn what the form is, when the form should be completed, where to access the form, how to complete the form, and some helpful tips to support you along the way. The Child and Family Team Meeting Referral Form is used by Behavioral Health Services, or BHS, Child Welfare Services, or CWS, and Probation to request a Child and Family Team meeting for the youth they serve. The Child and Family Team Meeting Facilitation Program is a joint contract between BHS, CWS, and Probation that is responsible for scheduling, organizing, and facilitating CFT meetings for youth up to 21 years of age who are receiving intensive care coordination, or ICC. The BHS provider is responsible for completing and submitting the form to the Child and Family Team Meeting Facilitation Program via fax or secure email. If the youth is involved in multiple systems, including child welfare services and or probation, or there is more than one BHS program working concurrently with the youth, the provider will collaborate with the other systems and providers to determine who will complete the referral form. It is the provider's responsibility to maintain compliance with child and family team meeting timeline requirements for youth identified as enhanced services subclass. Upon receiving the completed form, the Child and Family Team Meeting Facilitation Program contacts and invites all those listed on the form, including the referring party, BHS provider, CWS Protective Services Worker, or PSW, and/or probation officer, or PO, along with all other required formal and recommended natural support persons listed on the form. BHS programs complete the Child and Family Team Meeting referral form when there is an identified need for a child and family team meeting for a youth involved with behavioral health services. BHS programs must submit the referral at least 2 weeks prior to the CFT meeting due date. Need for a meeting includes compliance with mandatory timelines of 30 days after a youth is identified as eligible for enhanced services subclass through completion of the eligibility for pathways to well-being and enhanced services form, and every 90 days thereafter. Any member of the child and family team requesting a child and family team meeting regarding the best interest of the youth and/or family. If there is multiple system involvement or there is more than one BHS program working concurrently with the youth, it is important to coordinate timelines with the meeting requirements for CWS and/or probation, and whenever possible, combine meetings to reduce the impact of multiple meetings on the youth and family. You will be able to access the Child and Family Team Meeting referral form and the accompanying instruction sheet, which provides a thorough explanation of how to complete the form on the Fred Finch Child and Family Team Facilitation Program website. The link to the website is displayed on the screen. Scroll down the Fred Finch website to the Contact and Referrals section. Click the words "This Form" to download the Child and Family Team Meeting referral form. To make a referral to the Fred Finch Child and Family Team Meeting Facilitation Program, complete an email or fax the form to cftreferrals@fredfinch.org or fax to 858-335-3949. Complete all elements on the top of the form. Include preferences for the meeting date, time, and location according to provider needs and availability, but refrain from scheduling set dates or times with the youth and family. It is the Child and Family Team Meeting Facilitation Program's responsibility to coordinate the best date, time, and location for the meeting with consideration for the youth and family's preference. Complete all known information in Part A. This includes the contact information for all required child and family team members, Child Welfare Services Protective Services Worker, or CWS PSW, Protective Services Worker Supervisor, or PSS, Probation Officer, or PO, Supervising Probation Officer, or SPO, and Behavioral Health Services, or BHS provider. The Family Considerations section of Part A informs the facilitator of dynamics that may be occurring in the home, such as power dynamics, sensitive topics that may be uncomfortable for the youth to hear or discuss during the meeting, and the youth's name and pronouns. Completion of this section will allow for a more robust, safe, and collaborative meeting. The BHS provider may choose to have a more detailed conversation about these considerations with the facilitator before the meeting. Part B includes a reason for the referral. Check all that apply. This information helps inform the facilitator about the areas of focus during the meeting. Facilitators can effectively help create a safe environment during the child and family team meeting when all team members are aware of the reasons for the meeting. Collaboration and transparency between child and family team members is essential. Be sure to include desired meeting outcomes and goals. Pre-planning involves meeting with the youth and family prior to the child and family team meeting to ensure their voice and choice is elevated. To ensure safety during the child and family team meeting, alerts checked on this form are to be discussed with the CFT meeting facilitation program prior to the meeting. The facilitator will receive prior approval from either the PSW or PO to invite potential other team members. Additional support includes any potential team member who can provide the youth and family continual support, especially when professional supports are no longer involved. These additional supports, also called natural supports, create a support system that assists the youth and family in continuing to use their learned healthy coping skills and safety strategies. Contact the CWS, PSW, and/or PO regarding your child and family team meeting referral to ensure collaboration and teaming among the child and family team. Collaboration also allows for combined meetings. Include the referring person's phone number next to their name on the form if the referring person is different from the assigned CWS, PSW, PO, or BHS provider. Submit referrals at least 2 weeks prior to the requested meeting date. Collaborate with any other involved systems or BHS programs in determining which party will submit the referral, and refrain from sending more than one referral per youth per month. Contact CFT Referrals at fredfinch.org for referral inquiries. Information regarding common questions and the role of the Fred Finch facilitators can be found at the Fred Finch website. The link is displayed on screen. The Child and Family Team Meeting Referral Form is used by BHS, CWS, and Probation to request a child and family team meeting for the youth they served. In this course, you learned what the Child and Family Team Meeting Referral Form is, where you can access the form, and an explanation sheet to help you complete it, when you are required to complete the form, and when and how to submit it. Remember, the Child and Family Team Meeting Facilitation Program will schedule the meeting and contact all Child and Family Team Meeting participants based on the preferences you identify on this form, while prioritizing the voice and choice of the youth and their family. We encourage you to review the other courses in this learning series. Thank you for attending this course.